Today we're going to go over the correct procedure on how to do an intramuscular injection. This way you guys will be able to do it in the comfort of your own home. You should be receiving a syringe and needle. Typically it's a 23 gauge needle with a 3cc syringe. What we're going to have to do is take this injection needle off because they're going to provide you with a drawing needle. This is what you're actually going to draw the medication up with. So all you have to do when you get the needle is twist the current needle that's already on the syringe off, and you're going to lock the drawing needle into place. Make sure it's locked so it's not loose. Now, for an example, and typically doses vary, but we're going to do a 1 ml or 1 cc, which are the same thing. We're going to draw up 1 cc for the injection today. So if you can see, this is a 5 ml syringe. Typically you'll have a 3 ml syringe. We're going to bring the black plunger to the one. So whenever you do an injection, wipe the vial and obviously the area on the skin for injection with alcohol. So we're just going to wipe the top. There's a rubber stopper on the top of the vial. We're going to wipe that with alcohol and we're going to let that dry. Little trick that I like to do that allows, especially with oil-based medications, I'm going to put a little bit of air in the syringe. It allows for an easier pull when you draw the medication up. So take the cap off. You're going to put the needle directly in at a 90-degree angle into the rubber stopper. You're going to put air in the vial, turn the vial upside down, and basically pull back on the plunger. And since it is oil-based, the medication does come in slowly. Once we're at the 1, you're going to take the needle out, recap the drawing syringe, twist it off, and you're going to put on the new syringe. And this is the one that's going to be ready for injection. A lot of people are concerned if there are bubbles, if they are allowed to inject. What you can do if you find any bubbles, you're going to flick the side of the syringe and push up on the plunger until all the air bubbles are out. Okay. Alright, so for today we're going to use the gluteus for the intramuscular injection. The best place to do the injection is to either the right or the left side, whatever side you're doing, you want to divide it into quadrants. And we're going to do the upper outer quadrant for the injection. You always want to stay in the upper outer. For patients who complain of pain and soreness after the injections, you always want to stay above this intergluteal cleft because down here is where you're doing most of your moving. Up here it's going to be less painful after the injection. So that's a little tip as well. Again, you're always going to wipe the area down with alcohol and let that area dry. What I typically like to do before I do the injection, again, make sure all the bubbles are out. Push the plunger up slightly so some of the medication lubricates the needle. It allows for the needle to go in a lot easier for the injection. What you're going to do is hold the syringe and needle like you would a dart. This is intramuscular, so we're going to hold the skin taut. You're going to go ahead and just put pressure at a 90-degree angle and put the needle all the way in. Since it is oil-based, when you push on the plunger, it goes in a little slowly. You're going to go until all the medication is in, pull the needle out in the same direction that you pulled it in. You can use the alcohol swab or some gauze just to massage the area slowly after you do the injection. Typically when you do injections intramuscular, it is best to alternate, but you don't have to.